The reason I wanted to work here at St Bartholomew's Hospital Critical Care is really because of the speciality of the hospital being Bart's Heart Centre. I began my critical care career in St Vincent's in Sydney in cardiothoracic critical care way back in 2005, and when I decided I wanted to return to ICU in 2015, Bart's Heart Centre had just opened with the amalgamation of the 3 hospitals, and I knew this would be the place, an ideal place really, for me to return to critical care as a senior member of staff with my previous expertise and the specialities we offer here. So a typical day here at Bart's Heart Centre Intensive Care Unit starts at 8 o'clock in the morning or 8 p.m. at night. We start by gathering around for a safety huddle, and we listen to any key messages of safety. We call them the Big Four that the nurses hear before their shift starts, and that's when they receive their patient allocation. Once you know your patient allocation, you'll proceed to your bed space where you'll take a detailed handover from the previous shift, and this can take anywhere up to half an hour for the most complex patients. Once you've received your handover, you will do your patient assessment, safety checks and cleaning, and then prioritise your tasks for the day. The ward round will be round shortly in the morning and then again in the afternoon for you to communicate any key issues or any messages you have for the team and any things you would like them to consider, and then any tasks will be planned for that ward round, and the bedside nurse will then have the opportunity to proceed with those interventions. So what makes working here at St Bartholomew's Hospital so special for me is the location. We're in a central London exceptional location, good transport links all around. The environment is super modern. The intensive care units are bright and airy. We have natural light in all areas. The equipment is state-of-the-art and completely up to date. And we have really, really healthy patient to nurse staffing ratios and a healthy and a really, really safe, healthy work environment for all members of the staff. So the career development within the intensive care unit at St Bartholomew's is second to none. We offer a diverse and vast learning experience. If you join our unit, you will join one of the 15 rotating teams or one of the core teams within the critical care service. From Band 2 to Band 7, we have a professional development pathway, and you'll be supported by one of our 4 practice development nurses who work clinically and academically within the unit. So we offer study days, we offer team days every 2 months, and incorporated into those is cardiac advanced life support, airway, transfer training and cardiovascular care. For a Band 5 nurse, if you're a novice ICU nurse, we will support you with your competency packs, and if they've all been met, you can apply to go onto the ICU course, which is a 6-month course at level 6 or level 7, and that's based at City University. St Bartholomew's Hospital has really shaped my role on a professional and academic level. I came here in 2016 as a Band 7 senior charge nurse, where I worked for 2 years. Within the department, an opportunity came about for me to be seconded into a matron role, and since 6 months into the role I was made a permanent matron here at Bart's ICU. So my career has really accelerated since joining the department. In terms of academic, I've always wanted to complete my Masters. That's one of my main focus when I returned to clinical work in 2015. And I was really lucky enough that Bart's Charity fully funded my Master's degree fully and paid for study leave as well, which was a huge help in maintaining a good work-life balance. For my dissertation, I piloted a mindfulness pilot for ICU staff, and I'm pleased that piece of work has just been published to showcase that St Bartholomew's Hospital, we do care about health and well-being of our staff. It's a priority, it's really important to me and the hospital. So my aspirations at St Bartholomew's is to keep developing the ICU here at St Bart's. I want it to be the best cardiac critical care unit in the world. So my aspirations is just to continue developing the service, making it better. We can never be complacent. We have to keep moving forward to look at any ways we can improve things and all. And I'm open, my ears are open all the time to listen to suggestions from the staff. So if you're a registered nurse and you're interested in working in a world-class cardiac critical care unit, then please choose St Bartholomew's Hospital. The environment is super pleasant, super modern, the team is super expert and will support you during your career journey here at St Bartholomew's.